So, I would like to introduce Dr Michael O'Donoghue. He's going to be talking about what Australian vets are recommending for desexing cats and dogs. First, a biography. Michael O'Donoghue graduated as a veterinarian from the University of Queensland Veterinary School in 1992 and worked in small animal practice and is now working as a locum agent. He has a special interest in the human-animal bond and set up a business called People and Pets that coordinates a pet loss support service. He's also concerned about issues such as unwanted companion animals and pet-friendly property. Michael has been an active member of the Australian Veterinary Association since 2000, then joining the Queensland AVA Executive in 2008 and was the Queensland President for 2015. He is also the Northern Representative for Australian Small Animal Vets, and he's just recovered from 5 years of planning the FSAVA conference, which was an amazing success. So well done, and I'd like to introduce Dr Michael O'Donoghue. Thank you.
Thanks, Anne. Thanks for your introduction there. It's a great pleasure to be here today to talk to you on behalf of the Australian Small Animal Vets and the AVA. Really appreciate this conference. It's great to see so much initiative and positivity about these issues, and really want to see how Australian vets can be part of this solution. So that was the motivation to be here today. So this talk was based on 2 surveys that have been completed. The first one was a national survey taken in 2013, but take 3 years to really publish it, to analyse all the data and get it good for publishing. So it was only published in the Australian Veterinary Practitioner in 2016. And the second part of this survey I've done, I did this myself with Mandy Patterson from RSPCA, just based on Queensland results. So first, a little bit more about myself. Thanks for that introduction. And I've always had a particular interest or fascination with the human-animal bond. I've just always been amazed before I even was a vet about the impact that pets do have on people's lives, the amazing way they love us and encourage us and change us for the better. But always, as often happens, it doesn't always happen in a good light. There are often problems with the human-animal bond and it leaves us all stressed. So I'm also been really concerned about the well-being of pet owners and also people who work with pets, especially my area of interest is vets, but also I have concern for animal shelter workers. So yeah, that's just a picture of my dogs, Ruff, the Jack Russell, and a Rainbow, my Labrador, who's unfortunately fighting lymphoma at the moment. But yeah. And I also have 2 cats, Aussie 16-year-old fighting kidney disease, and a little cat, black cat. So we've got a very full household of cats and dogs. So this first survey was conducted by my colleagues, Valerie Luying, Mark Kelman, who was presenting yesterday, Michael Hayward and Michael Ward. So it's basically the idea was that there is no current recommendations or standardised recommendations regarding the correct age for desexing of dogs and cats. So the purpose of this study was to determine veterinarians' opinions and practices in relation to dog and cat desexing. So just the raw stats was for cats, the reported recommended age for desexing ranged from 0 to 9 months. The mean and most commonly recommended ages were 21 and 24 weeks, respectively, and the median recommended age for cats was 20 weeks. So just in terms of stats, my poor daughter's been studying this maths at school. I was trying to explain all the differences between these stats. But basically, apparently someone recommended 0 months of age. I'm not sure if anyone actually does that. It might be just the way the survey was completed. And at the far end of the spectrum, there was 9 months, and that might not be a very common response at all. So that pushes the median around. But still, we've come up with that most vets are saying 24 weeks. And just with dogs, similar kind of statistics. But the age of desexing is a bit older. Some vets are recommending anywhere between 0 weeks and 15 months. and the mean recommended age was 22.2 weeks. Again, the most commonly recommended age was 24 weeks. So I'm not sure how you feel about this when a lot of shelters would really like animals desexed a lot earlier, but it's still what vets are currently doing. So what can be done about this, or how can this be changed, or how does this really matter to reducing unwanted companion animals? So the next question we asked was, veterinarians were also asked what factors would encourage them to desex dogs and cats earlier than their current recommendation. So this again might be surprising that supporting scientific literature came in as the top answer at 45%. So there might already be a lot of good scientific literature about desexing earlier, but it may be they're not aware of it, or maybe they're not convinced of that scientific literature. Government regulation 18%, public demand 9%, and a technique workshop was only at 3%. So again, I thought that was a bit surprising, considering that a lot of people thought this might be the solution to helping vets want to desex earlier. It only came in at 3%. So I think, again, that could be a good learning about just encouraging the distribution of scientific literature, something I could be a part of. This paper, I think, has also got lots of good references on. It's in the your Lancet. Unfortunately, I didn't rename it, and it's like second on your list as a number 949 AVP Luying. So if you're looking for this paper, that's the title, unfortunately. So then we also asked what is the minimum age for desexing. So this is a different question than what vets would comfortably do or what they would normally recommend. It's a difference about what they would actually do if you ask them to do what's their minimum age for desexing. So the minimum age for desexing by Australian vets was 14.1 weeks for dogs and 13.6 weeks for cats, which is still considerably lower than reported in other countries. So Australian vets are doing well. Compared to just say in New York, was only 5 months in New York. Vets and early age desexing. The survey also showed that most Australian veterinarians are not opposed to early age desexing and recognise that early age desexing may be appropriate in certain circumstances. For example, if desexing is used to maximise the benefits of controlling stray animal populations, it's reasonable that veterinarians would consider desexing before 16 weeks of age. So that's a key point, is that they're very much supportive and see early age desexing appropriate in shelters and pounds. So that's a key difference, is about what vets would recommend in their own private practice with client-owned animals compared to what's necessary and what's appropriate in a shelter and a pound. But still there is discrepancy between vets, what they actually would do, and their perceptions around paediatric anaesthesia and the evidence in the scientific literature. So that may reflect their own personal experience or lack of confidence with paediatric anaesthetics. And so while there might be scientific knowledge that paediatric anaesthesia and the surgery is fine, it's something that they're not regularly doing. So if you're doing, I think it's just a different set of standards sometimes, and if you're not regularly doing it, you're not comfortable with it, so you're not going to regularly want to do that. I work as a locum vet, and one of the challenges of my job is to walk into a different surgery every day and operate under different circumstances, and I think I often find that a little bit stressful. So yeah, if you're out of your comfort zone and you're doing anaesthesia, you usually like things to be the same all the time. So the future is certainly, if we want to encourage vets to do early age desexing, further scientific studies are really important, as well as just showing vets the clear scientific literature is certainly a way forward to encourage this to happen. So just to tell you about the current AVA desexing guidelines, the AVA recommends that vets really must make their own decision based on current scientific evidence, consideration of the animal's weight, vaccination status, health status, and ability to withstand major surgery. So it's really important that the vet and the owner has a conversation and they base this on a mutual benefit for the animal and the owner and factors unique to each animal. So the second part of the survey that I personally was involved with was between AVA Queensland and RSPCA Queensland. What this survey was born out of was that when I came on as president, I think we'd had a lot of negative talks, or there was a lot of opposition. RSPCA was wanting to run their Operation Wanted, and AVA Queensland was sort of opposed to this idea about to reduce unwanted companion animals, and basically there was some animosity built up between the organisations and they weren't talking. I thought, look, we really need to work together to continue our work on reducing unwanted companion animals. We have a lot of values in common, and I thought, look, let's find a way to work together. And I thought the problem that we most need to work on, and there was less opposition about, was desexing kittens, or preventing unwanted kittens, because that seems where the largest numbers of unwanted animals come from. So I designed a study with Mandy Patterson to work out what were vets' attitudes to getting cats and kittens desexed before their first heat. So the first question is how important is the role of private practice veterinarians in preventing the birth of unwanted kittens? And it came in at 80%, or over 80% of vets are interested in private practice, are interested. 20% somewhat, and only about 1% saying of little importance. So that's really key that we all think it's very important. So what age are you recommending cats are desexed? Again, these figures are the same as the national survey. Basically, there's still 45% of vets recommending 6 months of age, and if you combine the others, still 55% under that period. The other was basically a different combination of that above figures. And then the next one was what is the actual age of cats are desexed in your practice? So you'll see it's fairly similar, but just skewed a couple of months later or a month later after they might recommend it. So there's still only about 8 or 9% of cats desexed over 6 months of age in veterinary practices. So I thought, well, what does it take? How do vets go about getting their clients to desex their cats? And so, do they take active steps to do this? And yep, 95% of practices are doing something about encouraging their clients to get their kittens desexed. So what are they actually doing in practice? So discussing desexing with new owners when they're bringing their kitten in for vaccinations, 96%. So it's something that almost everybody's doing. But then all these other things that are possible are only about 60 to 70% of what vets are doing. So to me, this is list. It's not comprehensive. There were quite a few other ideas about what we could be doing that we could improve on in terms of getting clients to desex their cats. So, rather suggesting desexing when the cat receives a final vaccination, 72%, or suggest setting a desexing date when a client receives its final kitten vaccination. So that's a really positive step that every practice could be involved in, but currently only 60% of practices are doing this. So we're looking at the results of their own perceived success. So only 30% of practices say they're very successful at doing this, and about 77% of practices say they're successful. So again, I see there's room that we could improve to get a much higher number of practices having a very successful approach to desexing kittens. Vets' opinions about why do you think people don't have their cats desexed before puberty. So one of the top reasons was they just forget about it or don't get around to it at 68%. And also they can't afford it or think they can't afford it at 73%. So I think there's often a huge emphasis on this second problem about the affordability of desexing. But not much emphasis has been about just forgetting about it or they don't get around to it. And I think this is a key thing about where vets and vet practices we could be doing about just encouraging people to do it, because it's, cost often isn't the real factor about why people aren't doing it. There's a few other things that we could be doing. So there's a whole lot of other excuses there we might need to come around, but they're the main ones. The operation's too dangerous, that they think it might be nice for their children, or they want to make money selling kittens. So they're all reasons that vets could have better approaches to having dialogue with their clients about desexing. So just a few comments from the survey. There's basically two kinds of comments from a range of vets. On one side, vets are saying things like, my vet, I work with the RSPCA, I do early age desexing, honours local welfare discounting systems, I lobby the local council, we should make desexing compulsory, the AVA needs to get off its interest cap, and we need to take immediate action, do everything. Compared to the other kind of comment was that I really wish welfare organisations would stop, often unintentionally, making private vets look like the bad guys, offering discounted desexing and campaigns such as Operated Wanted that are not means tested. Sends the message that private vets are overcharging for desexing and ripping off the public. It devalues the service that we provide and also rewards poor and irresponsible pet owners. It often feels that private practice vets are made out as the enemy when it comes to desexing, whereas welfare organisations need to listen and work with private practices. And I do understand this type of survey was an example of this. So that's two different kinds of approaches that vets feel. And I think there's opportunities like through this survey about looking at those little other marketing things. It's not about price and it's not about age, that vets could be doing to improve desexing rates. So just a few other comments that I don't have time to read them all, but it's rare for my clients to have kittens, or we're only capturing people that actually bring their kittens to the vet. We rarely have entire feline patients. Most cats we see are already desexed. It's just that vets are only a small part of this unwanted cats situation, but they're keen to do whatever we can to be a part of it. I might just skip that comment. There are low responsible pet owners who do never visit the vets, do not get their kittens vaccinated, and make their first visit to the vet when they finally decide to get the pet desexed. Therefore, we cannot influence people we have not had direct contact with. So, in conclusion, I'd like to say that 99% of vets are really interested in reducing unwanted companion animals. 99% of vets are recommending desexing cats before the first heat. But there is a significant number of vets opposed to desexing client-owned cats at 6-8 weeks of age, and a significant number of vets opposed to further discounting on desexing procedures. So, let's work together at helping vets can work together to reduce unwanted companion animals. So I'm also interested in other projects that about working together to make this place a better world. Working with Mark Kelman on making parvo history, running a pet loss and grief support service, a national network of counsellors, and pet-friendly property, working on national strategies to help people rent with pets. So I think there are ways to improve the lives of companion animals by communicating with all concerned parties. So I've had plenty of opportunity this conference. Find the common ground that we all have and come out with an action plan. So hopefully we can all work together and achieve these aims. So thank you very much for your time.